If you had the cure for lung cancer and the chance to eliminate it from our society, would you? Well, I would think you would. Well, you actually can, and that's stopping cigarette smoking. Not only for yourself, but for your family, relatives, friends. If you are a smoker, or you know someone that smokes, I am here to tell you and convince you to stop smoking today, or help someone to stop smoking today. I'm a nurse. I'm going to give you some helpful information that will hopefully change your minds on cigarette smoking. According to the National Institution on Drug Abuse, cigarette addiction, one out of 10 quit but do not follow through because of the temporary side effects such as headaches, grouchiness, restlessness, depression, and hunger. 8 seconds after inhaling cigarette, nicotine reaches the brain, the pleasure center of the brain, so therefore making the person who smokes become more addicted. Because once they start smoking, they continue to smoke, and they cannot get that effect of pleasure that they had gotten prior. So they keep smoking, the body builds up tolerance, and therefore it becomes harder to break the addiction. Well, I'm going to give you some interesting facts that will help you in hopefully quitting smoking today, and give you some information on what cigarettes do to your body. The National Cancer Institute states that in the brain, cigarette smoking reduces oxygen supply and increases risk for stroke. It can cause depression, headaches, and mood changes. In the arms and the legs, it damages blood vessels and circulation, which can cause ulcers and gangrene, which can later, you can eventually have amputation. In the eyes, cigarette smoking doubles your risk of cataracts and macular degeneration. Macular degeneration is deterioration of eyesight. In the lungs, according to the American Lung Association, it causes 4 out of 5 deaths from bronchitis to emphysema and lung cancer, and increases the risk of pneumonia and makes asthma much worse. In the abdominal area, it increases risk of cancers of the stomach, pancreas, bladder, cervix, kidney, and liver. It increases the risk of stomach ulcers and diabetes, and worsens their symptoms, and can bring on menopause up to 2 years earlier in women. In the heart, it increases heart rate, it increases blood pressure, it constricts blood vessels, it decreases the oxygen supply, and causes 1 in 4 deaths of heart disease. So here we have 5 people, 6 people. So one of us whoever smokes could end up having heart disease. Circulation, it narrows and hardens the arteries, increasing the risk of heart disease and stroke. It increases the blood cholesterol levels. So if you already take medication for your cholesterol, then if you smoke, it's kind of, one may outweigh the other. Most likely your cigarette smoking may cause the medication not work as properly. In the mouth, it increases the risk of mouth and throat cancers, gum disease, and tooth loss. It decreases your sense of taste and smell, delays wound healing in the skin, and causes early wrinkling and aging of the skin, and doubles the risk of psoriasis, which is dry, scaly skin. In the bones and joints, it weakens the bones and increases your risk of osteoporosis. So, why would you smoke after hearing all of those interesting facts? There are so many risks with cigarette smoking. Don't be another statistic. There are ways to deal with this addiction. One, you can contact your doctor, and there are prescription medications available to help you with stopping smoking. Also, you can chew nicotine gum and try the patches over the counter. But the best way to stop smoking is cold turkey, just to stop. The effects of the addiction withdrawals are only temporary, and you can get through that. You can also call 1-800-QUIT-NOW, and and you will get more information about tips on quitting. I'm hoping that these facts have persuaded you to stop smoking, and if you know someone that they help you with help them stop smoking also. So don't let cigarette smoking win the battle over your life. Stop smoking today.